Predictive oncology is on the leading edge of applying artificial intelligence and machine learning to drug discovery and drug development. We are a company that utilizes artificial intelligence as a supplement to our deep understanding of the science of drug discovery.
Traditionally, in drug discovery, if you have a set of 300 compounds or 100 compounds and 100 tumor samples, they're testing every single combination. We're saying we can do it in a smarter way, a more efficient way. So we're using AI to train models, learning from information that we have about compounds and tumor samples, and then making future predictions on experiments that we haven't yet run.
Traditionally, there's been a lot of reliance on maybe cell lines or animal models in order to identify which drug compounds are going to be the most effective to take to clinic. The way that we change that approach would be taking what we have in our biobank, incorporating that into the drug discovery process earlier on is going to allow drug companies to assess their drug compounds in a more real-world setting.
We do clinical testing on patient samples. Then the other side of our offering would be more in the research and development area, and that's where our PEDAL platform fits in. And that's everything from the artificial intelligence, which is technically machine learning or active machine learning, and the things that we do to get information out of what's held in our biobank.
The platform refers to specifically patient-centric information that utilizes active learning.
I think we are the first to use active learning in the drug discovery process. We really shifted our approach to be data-driven, AI-focused, and saying, okay, we've aggregated all this data on all these tumor samples. How can we start to leverage that information and make future predictions on drug responses?
The PEDAL technology is useless without the biobank of 150,000 tumor samples.
We've got 150,000 tumor samples available across a broad range of tumor types. Combining those with our wet lab expertise, that's really where we are most impactful, is that those three things as a grouping, they don't exist anywhere else.
To have that machine learning and then to put that together with what we have here as the asset with the biobank, I would say that is kind of our new generation of what predictive oncology is.
The combination of the introduction of that patient heterogeneity earlier in the process, and then the machine learning, the AI that can generate high confidence predictions about how a patient is going to respond to a drug, that is really where you can change the game when it comes to drug development.
Companies like this don't exist without a significant amount of financial support. Everything in this company and all the money that's come into this company has brought this company to the point right now where we can make a real difference in drug discovery and drug development. But more than that, we could not attract the brilliant people that we have in this company. They chose to work here for us and with us for a common goal to move this company forward. And none of that is possible without ongoing financial support.
I would say that to invest in predictive oncology is to invest in the future of drug development and drug discovery, and to really invest in people.
This organization does tend to think outside of the box. I believe it always has. Now, the thing out there with the machine learning, when we found that we could, acquire that into our organization and then utilize that against the biology of what we have in our samples, that is pretty cutting edge. There's really nobody out there that I can think of that has a commercial offering with the artificial intelligence in the way that we're using it.
What we're doing here is something that's not been seen before. I think, the scientific rigor and the execution is 100% there. And we've proven that the accuracy and the actual modeling is 100% there. And so we have an opportunity to really shake up how things are done in the cancer research arena and also in the drug development arena.
We are not an artificial intelligence company. We are a company that utilizes artificial intelligence as a supplement to our deep understanding of the science of drug discovery and drug development.
We have a wonderful collection of scientists that are working here every day. They want to make a difference. They want to be a part of that answer for treating patients with cancer. They are all very focused on that. They all believe in that, and that's what makes it interesting every day.
It just so happens that my mother, my father, my brother, my uncle, my grandfather died of cancer. And so when this domino effect started to happen 15 years ago, I basically gave up all the other business enterprises that I was involved in and focused entirely on oncology research. What I tried to do is coordinate everything. Anything that was advancing the research could expedite the research for finding cures or develop therapies for patients living with cancer or dying from cancer became a mission for me.
I mean, I think everybody has a story. Everybody's been touched by cancer or knows somebody that's been touched by cancer in some way. I mean, for me, my mom is a breast cancer survivor. It is personal. It's a thing that motivates me to make a difference. And yeah, that's why I get up and come to work every day.
I lost my own father a year ago to prostate cancer. And so, I know I'm now acutely aware of what it feels like to want another day or another month or another year. And so if anything that I do here can give somebody that additional time, then just one person, then that's all I need. That'll get me here every day.